Coming up next on Being Well, periodontist Yulim Kim will be our guest. We'll be talking about all things related to our gums, how to keep them healthy, and what types of treatments are available if you're diagnosed with gum disease. We've got that and the latest health news coming up next on Being Well. Well, Dr. Yulim Kim, thank you so much for coming by Being Well today. We're talking about gums and not the chewing gum kind of gums that are in our mouth.
Yes.
You're a periodontist, and when I told people we were having a periodontist on, the first thing it said, what is that? I've never heard of that. So have you explained what you do?
Sure. Basically, in a nutshell, periodontists save teeth.
Okay.
So our mission and goal is to make sure that we save teeth for our patients.
Okay.
We also work with the general dentist and other specialists in dentistry, and we try to give the best comprehensive care that our patients deserve.
So what you have additional schooling, so do you go to school first to be a dentist and then go on for?
Yes, so we go to undergrad for 4 years, dental school for 4 years, and then 3 years of specialty training in periodontics. And we concentrate and gain expertise in a specific field of dentistry, which is in periodontics, looking at gum disease. So gum disease have many names: periodontitis, periodontal disease, gum disease. Experts in placing dental implants and also performing periodontal surgeries. If we have severe gum disease, then you have bone loss and maybe getting the bone back to help, or periodontal cosmetic surgeries where we can give you the best and beautiful smile that you deserve.
So, you deal a lot with the gums. What is the purpose of our gums?
Well, gums you can kind of think of it as a barrier, kind of like when we have skin. Skin's protecting our muscles and nerves and blood supplies. So with gums, they form the natural defense, and we have two different types of gums. There's one that's right around the teeth that are more tight, and form a tight seal around the teeth. And then we have a little bit of loose tissue where it kind of aids in chewing, and when you smile, just kind of stretches a little bit, okay? And gums also protect bone. So wherever gums go, bone follow.
Okay.
So if you have loss of gum tissue, then you also have bone loss.
Okay. So let's talk about what are some of the causes or the causes and signs of gum disease, because it's something that's pretty common in a lot of people.
Right, and as you have asked before, are some people prone to gum disease? And that's definitely true, and that's the reason why some people have a milder form of gum disease, and others are more severely involved.
Okay.
Gum disease actually affect our teeth support, so the structures that are around the teeth. One of the first warning signs may be when you see like red, swollen, and bleeding gums. That happens when plaque that starts as colorless and invisible layer on the teeth and right at the gum margin start to build up. If you don't do a good job with brushing and flossing, then it just continues to build up. It's okay if it stays at the gum level, but it also starts to penetrate under the gum tissue, and then it starts to separate the tissue. So when it's right at the gum line and it's just red, swollen, and inflamed, and it bleeds, then we're at gingivitis.
Okay. Which is still mild.
Yes.
Still doesn't require anything too drastic at that point.
So it's still reversible with good home care, so brushing 2 times and flossing 2 times per day. We can bring it back to health.
Okay.
Now, if the gingivitis goes unnoticed, because I think we all know that with gum disease, a lot of people are not aware of it just because it's known as silent disease, because it doesn't hurt. people.
Right.
So when it goes unnoticed and are untreated, then it becomes periodontal disease. So then plaque starts to harden, become calculus or tartar, and then they start to separate the tissue from the teeth.
Okay.
And then there's space that forms, and those
all
are
that
called
stuff can get down in there.
right, and those are called pockets.
Okay,
and
I've
the
heard
plaque-
of pocketing, or the dentist
Right.
will kind of test that and
Yes.
say you have
Yes,
pockets.
that's what we're measuring. So
Okay.
how deep are the pockets? How much tissue has detached from the teeth?
Okay.
And if the detachment is severe, and when you start to see the bone loss, then you can actually start to see the teeth wiggle and ultimately become very loose to the point where they fall out.
Okay. Can this happen? Is it just something that affects older people? Can it affect people in their 20s?
Yes, it
Okay.
can affect people as early as 20, 30, 40. And traditionally and historically, periodontal disease has been, I guess, labeled as an old people disease, but it's not true. To go over some of the signs of periodontal disease, so you can have red, swollen, and tender gums, bleeding. So, I think it's somewhat normal for people to think that, oh yeah, I have, a little bit of bleeding around my gums. It's okay, it'll go away.
Yeah.
But studies have shown that if you actually have pockets that are 5 or 6 millimeters all around your mouth, and you actually move those pockets out and actually measure it, it's as big as your palm.
Really?
Yeah, so if you have a lesion that's as big as your hand, let's say that, it's on your leg or something,
Okay.
you wouldn't just say, oh no, it'll go away.
Yeah.
You
Okay,
would
so
see-
relatively
Absolutely.
comparing.
Absolutely.
Okay, I gotcha.
So it is a big deal. Other signs are gum recession, so tissues that are just kind of pulling away from the teeth, so your teeth kind of look a little longer. Loose and separating teeth, maybe pus coming out between the gums and teeth, and maybe you might notice that your teeth don't fit together as well
Okay.
as they used to. Maybe your bite has shifted a little bit, or people that have maybe like removable partial dentures, or some people call it a partial plate or a flipper, maybe those prostheses don't fit as well because teeth have shifted.
Is bad breath a sign of gum
Yes,
disease as well?
Yes.
Okay.
So bacteria, we have many, many types of bacteria in our mouth. Most of them are good. They don't cause any problems. But there are some that are very bad, and they do cause periodontal disease. Now, when you don't, on top of brushing 2 times and flossing 2 times, you also need to brush your tongue.
Okay.
Because when you kind of look at the tongue under a microscope, you see a little bit of projections that kind of looks like a little mushroom. And bacteria can actually get stuck under there and start to digest anything, plaque, food, sugar, and then start to produce byproducts that cause strong odor.
Okay. So there's a tooth loss is bad enough, but if you have gum disease, periodontal disease, it can actually lead to some other things that I was actually very surprised, can result from gum issues.
Yes, yes. So one of the new studies point out that there is an incredible link between gum disease and pregnancy.
Okay.
So if when a pregnant woman has gum disease, then they have actually 7.5 times greater risk of giving birth to premature and or low birth weight babies. Now, when pregnant women actually have gum disease, they smoke and drink, then the risk factor goes up drastically.
Really? And there's also risk of heart disease.
Yes. So with heart disease and heart attacks, when you have bleeding in your gums, we have blood vessels that are running through our entire body. So periodontal bugs can actually travel and go throughout your body and if they actually get stuck in the heart, and those bacteria can actually cause clotting of your blood, and the clots form, then you're in a danger of having a heart attack. And the plaque buildup that you see with gum disease, well, those are the same plaque buildups that you see with heart attacks.
Really?
So with the plaque buildups inside the blood vessels, then the blood vessels start to become smaller and smaller. Circulation is not as good, and then you start to have different problems.
So it's not a good thing.
No, it's not a good thing.
Well, let's talk. There are ways to treat it. Let's talk about some of the most common procedures that you do in your practice to treat people with this.
Well, actually, you are the most important player in this team.
Okay.
So, brushing 2 times, flossing 2 times, brushing your tongue 2 times per day. Just adequate home care is the number one.
Which is so inexpensive, and it really doesn't take. I will admit, I was not a good flosser, and then I finally got on board. And when I realized it takes about 30 seconds, it's 30 seconds that can save a lot of pain and heart and things down the road.
Of course. No, I'm very glad. So it starts at home, but you also still need some regular professional dental cleanings by hygienists, dentists, or periodontists, just because brush bristles can only go maybe 2 to 3 millimeters below the gum line.
Okay.
So that's about like 1/16 of an inch. Let's say you have pockets of 4 and 5 millimeters. There are 1 to 2 millimeters that your brush couldn't get to remove bacteria. So then you do need our help. You do need our professional help, and we do need to get in there with our dental instruments and get rid of the plaque and bacteria.
Okay. So if they've done all that and they still have some issues, what are some of the things, the procedures that you do to kind of help reverse some of that damage?
Sure. The most common procedure that we do at our office is what's called a scaling and replaning.
Okay. So I've read that. It doesn't sound pleasant.
No,
Root scaling and root planing.
I know.
Tell us about what that is.
Right. So they are known as deep cleaning.
Okay.
So as the picture shows, you may have some plaque buildup right at the gum line or right below the gum line, and we have to take our instruments and remove the, I think this picture shows the yellow plaque and tartar. So that's scaling and replaning. We go just a little below the gum line. Now, when we have to go down to the root surfaces and remove a little bit more of the tartar buildup or plaque buildup, then that's known as root planing.
So do you do the whole set of teeth, the whole mouth and everything?
Yes and no.
Okay.
Mouth is divided into 4 different quadrants. So we have upper right, upper left, lower left, and lower right. At our office, in general, we'll do 1/2 of the mouth at a time. So we'll do upper right and the lower right. So generally, I'll lower my patient back. We'll go ahead and give some topical numbing jelly first, just so that I can numb up the surface. And then patients do get shots at our office. I know
They're not as bad as they used to be. I was just at the dentist. I remember as a kid, it felt like they were injecting with something that the size of this pen.
Yeah.
It's still not fun, but
No.
it has got, if you have not been to the dentist, there's a lot of advancements have been made in dentistry in that needle.
Of course. And then just go ahead and use my instruments, and I kind of call it a spring cleanup.
Okay.
So it's a dirty environment. We have to go in there and clean. And then I call it a dirty bacteria infested sweater. So plaque and tartar are around your teeth and roots. When I go in there and remove them, your teeth are going to feel kind of cold. Even though it was bacteria infested sweater, it was still kind of
cozy and warm.
Yeah, it was still providing some insulation around the teeth. And so initially, for about a week or 2, you're going to have some cold sensitivity, and that's the most common side effect of scaling and replaning.
Okay, so you have another one called gum recession.
Yes.
And this is, when does someone actually need this?
Sure. So as we discussed, there are genetic predisposition for gum disease. Same thing with tissue grafting.
Okay.
Some people are thanks to their mom and dad, have a little thinner tissue than others.
Okay.
When you don't brush properly, so we go over brushing in a small circular motion, but if you were to just kind of go horizontally and aggressively and brush your gum tissue away, you can do that. So recession occurs.
That's when your teeth look longer than
Yes.
they used to.
Yes, and then definitely gum disease, because plaque and tartar are more like irritants, and our body stays away from irritants. So the gum tissue's natural reaction is to, okay, I'm gonna go away from the irritant.
Right.
So it just recedes away. Bite overload. So if you have maybe malaligned teeth, or maybe you have one tooth that's a little higher than others, kind of like my middle knuckle.
Okay.
My middle knuckle is higher than the rest of it. So if one tooth were to constantly hit that tooth first,
Okay.
then I call it a minor earthquake around the teeth. So tissue don't hold on to the moving object very well, so it starts to lose its attachment.
Okay.
And then
So
you have recession.
let's talk about how you fix that.
Sure.
I have some personal experience with that, so I know the answer, but I want you to explain it.
Sure. So I'm not sure if the picture actually shows the color difference, but if you were to take a look, the tissue color right next to the tooth is a little bit more salmon pink. And then it's a little darker color tissue towards the lip for both top and the bottom.
Okay.
So when you have, and the lighter color tissue is called gingiva, and the darker color tissue is called mucosa. So when the gingiva starts to recede away, the teeth do look a little longer. And so we can cover the exposed roots to make sure that you don't have any more sensitivity. Or we can just thicken that tissue and make sure that you have thicker and healthier tissue that your brush or some other trauma cannot remove.
Okay. And you take that tissue from the roof of your mouth.
Yes. So actually 2 ways of getting the tissue. The first and foremost is the roof of the mouth. We do have to get the tissue from somewhere.
Yeah.
It's your own tissue, so it actually works the best and gives you the best result. If the area is really big and the patients are just adamant that, you know what, I really don't want you to go to the roof of the mouth, I'd rather we go to another tissue source, then we do have the cadaver tissue that we get from the tissue bank.
Okay.
And those are used for burn victims. Now, once again, it's not yours, so it doesn't work as well. It has kind of a weird smell as it heals too, and it doesn't look as good as your natural tooth or natural tissue. So at least for my procedures, I always recommend that we go with your natural tissue.
And so that kind of repairs that and sort of covers that up, and that tissue actually starts to regrow. It attaches itself to the new tissue.
Yes.
Okay.
So we take the layer of the tissue from the roof of the mouth and then suture it down to wherever you need it.
Okay.
And then it actually attaches.
How long does it really take to actually attach?
The first and initial attachment takes about a week or 2.
Okay.
And then for the tissue to fully mature, it'll take anywhere from 4 to 8 weeks.
Okay. Anything else on, I want to talk a little bit about implants.
Sure.
Is there anything else we need to talk about as far as root planning, root scaling, tissue grafting?
I don't
Okay. Well, the other thing you do is dental implants.
Yes.
Back, I don't know how many years ago, the only choice was dentures, and now we have implants, which is
Right.
something that you provide.
Sure.
How do you decide if someone what's the difference between a bridge and an implant, and
Of
how do
course.
you determine which would be better for somebody?
Of course. So 3 ways of replacing missing tooth or missing teeth. As you said, it used to be dentures, and then we had a bridge, and then now we have dental implants.
Okay.
Dental implants are more like a medical device, kind of like when you get a hip replacement or
It's a tooth replacement,
Yeah,
really.
it's a tooth replacement. So you can see right over here that the natural tooth will have a root and a crown, so it's pretty much like a 2-piece. Whereas the implant tooth will have the implant titanium post that gets bound to bone. That will simulate your root.
Okay.
And then your general dentist will be able to add the connector and the crown on there. So
Okay.
it's actually a 3-piece.
Okay, so your part of it is putting this thing in.
Correct.
The screw.
Yes,
for
yes,
lack of
it
a
is.
better
It's
word.
a very, very expensive titanium screw.
Okay, in your mouth. And do you have people that have like multiple?
Yes.
Like their whole mouth is done that
Right.
way?
So what happens is teeth are basically a gatekeeper for your bone. When you lose teeth, then there's a big hole. If you don't have anything that's occupying that hole, then the bone just starts to resorb. Not only that, not only does it start to resorb side to side or front to back, it actually starts to resorb top to bottom. So your bone starts to deteriorate down. And anytime patients have a partial denture or a full denture, if you don't have enough bone height or the width for those dentures to hold on to, then they start to move.
Okay.
So implants not only offer a good replacement option for one tooth with a crown, but also you can get multiple implants placed so that those dentures can be secured on.
Okay. All right. Well, as we kind of wrap up here, just give us a few things that we should be doing to keep our gums healthy. Maybe the better way of asking that question, what are the biggest mistakes you think that people make or that we're not doing that are really harming our gums and teeth?
Okay, sure. Sometimes our patients come to our office and say, no, I do brush 2 times per day and floss and whatnot. I would say the number one commonly reported brushing mistake, I guess I should say, maybe people brush for only 30 seconds.
Right.
We need to brush for full 2 minutes. In small circular motions.
Not too hard.
Right, not too hard. It's not the force or the pressure. It's actually the time that you do it properly that matters.
That's why those electric toothbrushes or battery-operated ones that have the timer on are really good.
Yes. Flossing properly as well. We need to go up and down in a C-shaped motion. You can't just go seesaw horizontally.
Okay.
Okay.
And not just up and down real quick.
Right.
Yeah.
No.
So in a C, like the C going up towards your gum?
Towards your gums.
Okay.
Right. And you need to go up and down maybe about 2 to 3 times. You can't just go in and out.
Okay. I think that's what I'm doing. I'll work on that.
And definitely just seeking regular dental checkup. Once again, periodontal disease is a very silent disease. It doesn't hurt you, so you don't know that you have it. So before it gets to the non-reversible stage, we should definitely prevent it and stop at health and make sure that it doesn't even get to the gingivitis
Yeah,
stage.
because it actually can have other, there's other things that can happen besides just, what's happening in your mouth. So it can be pretty significant if you don't take care of it.
Yes.
Well, we're all out of time, Dr. Kim. Thank you so much for coming over. We appreciate the information you've given us, and hopefully everyone watching will start flossing a little more and brushing for those 2 minutes.
Sure. Thank you.
Thanks.
It could be your mom, sister, aunt, or best friend. 1 out of 8 women will get breast cancer in their lifetime. A small subset of the women who get diagnosed have inherited an abnormal copy of a gene that runs in families and can greatly increase their risk of certain cancers. One question these women and their families face is, should I get tested to find out if I have a genetic risk? The answer is always a very personal one.
She was just a very positive person, and particularly when she was fighting cancer, she had nothing but hope.
Mary Holmes' sister Debbie lost her battle with breast cancer when she was just 30 years old. She was diagnosed at age 28.
She was about 5 months pregnant, and she noticed a lump in her chest.
Because Debbie was so young, Mary's family did a little research and found out some people on her dad's side of the family carried a breast cancer gene.
We went ahead and got her tested, and she was BRCA1 positive, and then I was tested, and I was the same.
There's a common myth out there that you can only get this from your mother's side of the family.
Genetic counselor Megan Roberts says that's not true. There are 2 commonly known breast cancer genes that can run on either side of your family. They increase a woman's risk of breast cancer by about 80% and her risk of ovarian cancer by about 40%. The question is, if it runs in your family, should you get tested?
I tend to think about it in terms of knowledge. Having the knowledge is power. Once you know that you have a mutation, you know you have a certain risk, you can take steps proactively to find things quicker at an earlier, more treatable stage, or you can take steps to prevent cancer. And you can inform your family so that they can take steps to protect themselves as well.
Dr. Stephanie Hines says if you have the gene, you can increase surveillance with tests like self-breast exams, mammography, and MRI. Or you can take medications such as tamoxifen, or have a mastectomy to remove both breasts, or surgery to remove ovaries, since your risk of ovarian cancer is increased too. Once Mary learned she carried the BRCA1 gene, she chose surveillance. She recommends all women considering genetic testing know their options so they can make informed decisions.
Because you need to know what you're going to do with the information.
Information that will help keep Mary and her family cancer-free. For Medical Edge, I'm Vivian Williams.